Hi, everybody. I'm Greg Miniger. I'm the Senior VP at SIS-NW. Today, I'm joined by Larry Juergens and David Boxberger. Our moderator, Liz Garnand, will be helping with questions in the chat window. We will answer any questions you may have at the end of our presentation today. We suggest that you turn off your video for better webinar performance, but I'll leave that up to you. Your audio will be muted. For today's webinar, the three of us will be presenting Restructuring Healthcare Operations for Financial Success. All three of us have many healthcare facility clients. We want to share the insights that we've gained from our relationships about trends with your peers and how they are dealing with some of the current issues that you are trying to address. Specifically, our agenda will include forecasts for healthcare, how to make the best of the current situation, considerations for having remote workers, a little bit about us, and where you can start. So let's begin, and we'll start off with some challenges that most businesses face. I'm going to hand things off to Larry.
Thank you, Greg. As Greg mentioned, the impact that all of us are navigating through the pandemic has been difficult, to say the least. We hear the terms of new normal and new norm, and as everyone on today's webinar is impacted differently, we're going to start to look at, for example, some case loads. So as we go to the next slide, we're going to be looking at a study where this chart demonstrates the impact of COVID and measuring some of the decrease in patient volumes by specialty. And I apologize, let me mute. And this study was done originally in April 5th, and that's the orange bar. And in the green bar is as of May 10. As you can see, it's by specialty, but there's also some correlation here in terms of demographics as well. But needless to say, everyone has been impacted with this. And so how do you then accommodate this, and what are practices doing today that's going to get them even further down the road and mitigate some of the problems and challenges that we're also seeing in patient volumes, and how what we can do and what groups are doing out there to in fact mitigate this decrease. And we're going to call that, in terms of moving forward, I'm calling it the curve. The curve is both bending the curve. This is financially bending the curve, so that's revenue. You're going to be bending the curve from an operation, and possibly also what we're going to talk about is the human resource, our staff and our patients as well. So scenario 3 is really having an effective, complete recovery action plan in place, very well thought out, and executing that. And that's really, this can be, again, the financial, the revenue, could be patient volumes. Obviously, they're very linked. They could be very similar, if not the same curve. But we all experience the drop. Now, what can we do? And best case scenario is scenario 3, and you're effectively doing that on that plan. Now, scenario 2, and these are real measures, by the way, that at CLA, and where I am calling from and where I work, we have this model. And this model is actually showing you the results of some decisions or delays in these decisions. And you have a marginal recovery action plan. Sometimes it's out of your hands, we realize that, but just to know, okay, it's going to take us longer or shorter based on what we're allowed to do here. Scenario 1 is if there's plans here that really don't have an action plan, and there's minimal plans going on. They think the norm of pre-COVID is the norm today as well. So those are the different scenarios, and we're going to take a little bit deeper dive now on those scenarios. Then we're going to talk about a little bit on the capacity and demand. So really a matter of new measures now are necessary. Things are so different. And since they are new, we need to build in some forecasting. Some groups with experience of backlogs, some excessive capacity. Maybe they had prior backlogs in their patient volumes and appointments. Now, under the new scenario, what can you start doing, and how do you measure this in the new norm, as we call it, both financially and operationally? And then, of that, what's the impact, and why are we not seeing the same amount of patients? And that's really to the next bullet here, is really we need to talk about safety. Safety is a huge deal, and we're all required to go through the proper cleaning techniques that is required. You have social distancing, all of those things, and in creating new precautions within the options, and what are the opinions of your patients. And you really need to absolutely convince your patients that you're a safe or clinic or hospital organization that you can see patients. And there's really a checklist out there that really has to be followed. The other impact and plans is that, look, we have our lives. We have now the school is relatively out, but we still have our own family members. We have our staff that's concerned about COVID, and really, how can you utilize the remote workers, and what needs to be put in place? Staff burnout, physician burnout, provider burnout, administration burnout, all real stuff, right? So how can we still keep us together if you have that family environment and you want to have a cohesive group, but yet be productive? How are you managing that? And there's certain aspects, and there's great technology out there that supports this as well. So now, how do you anticipate your future, and what are the plans and options that are available? Human resource and technology in use. For example, we have great financial options. Most of you took that, if not all of you took advantage of that's the opportunity from a federal funding standpoint. Now, additional steps are needed, right? You have to be tracking, reporting all your expenses, requirements, doing all of those. I would really like to, point out the next bullet here: enhance the technology. We have seen the groups, their overhead is increased, their staffing model, and they're seeing less patients. So there's all of this overhead increase. What technology pieces are out there that we need to ask ourselves, and what we're seeing out there? And most groups have quickly adopted, for example, the telemedicine, which is fantastic under the adjusted HIPAA and coding rules, and reimbursement too. How is that going to look in the future for us? Now, start looking, and perhaps you are already. We see a lot of groups now, patient appointments. How can we automate that? Electronic registrations and pre-registration visits, and assisting, the pre-visit planning. We see groups now adopting assisting coding and automated clearinghouse, and certainly denial management and denial prevention. I think this is also a great opportunity. We help our clients start looking at their service lines. Analyze those, do a cost to benefit ratio, analysis on your service lines. Are they still viable? Or are they also, can you add service lines that may perhaps you thought of? Now's the time to do it because it just makes sense. Lots of groups now also take a look at your pricing of the patient from a patient's perspective, pricing as well as out of pocket. What types of things can you do as a clinic and healthcare facility to accommodate that? And in this day and age, it's amazing how much more collection ratio we're seeing from utilization of that technology. People pay a device more than they pay a person these days. So we're seeing a lot of that as well. The risk mitigation, that's risk mitigation for not only it's the patient, it's your staff, it's for the clinic and hospital. Making sure everyone is safe, and feeling that and communicating that, and then also just financial risk, all of the above, right? And there's a huge list of components to that. So if we're looking at this new norm and how we're going to, go back into practice, we like to take a look at it in 3 different phases, for example. I know there's different models out there. For today's purposes, we're just going to look at it from reopening, phase 1. The timing, we put in there April to June, but honestly, across the country, the dates really change. And so what we're doing here, though, is some of this may be completed, but may not. So our suggestion here is really have a new framework, a framework of operations and workflows and financial framework. Now, we really want to stress this as well. End of the year vision. What do you want to do as an end of year vision of profitability? Do you want to be break even, or you're slated to be at a loss at the year? And at least you have some type of goal, if you would, and then you can absolutely start to take a look at bending those curves to make sure you're on track to where you want to be, and to restore that and develop an outward facing communication plan. This is absolutely essential. We're going to talk a little bit about the patient's perspective and as well as your employees. So develop a execution of a communication plan, and that is components of utilization of your website, text messages, social media. Phase 2, we're calling this the catch up. So recalibrate your 2020 plan. This is a perfect time, we're mid-year, and what changes are necessary and that we will have to stay at least through 2020. We've taken our strategic planning, instead of taking a look at a year or 3 years or 5 years, we've taken it about every 6 months. Just do it. You got to be rapid. You got to be agile as a company. So recapture the processes, prioritize your scarce resources, and the operations, staffing, and absolutely communication in that. And you're always working as management ahead of this, right? These are the things that you're trying to execute during these times, but you're planning now for stage 2. Now we're going to go to stage 3. So again, this is a good opportunity to take a break, take a look at what's working, what's not, realizing it's been 3 months, but just then replan for the next 6 months. And then what things can we restore? Are we on? How can we prioritize staff and operations and communication? How's our billing going? Because we're seeing a lot of different denials, for example. And are we on point or not? And I guess to sum up this is really all this slide is that you need to be proactive in all of these areas. How you used to do business is not how you're going to be doing the business in the future. I think we all realize that. And to sum it up, it's really going to be, you need a plan. Don't expect it to happen magically, and it's just makes a huge difference on bending the curve, shortening that the dip that we're all seeing. So, thank you for attending. And I'm now going to turn it over to David, and he will talk further about today's operations and providing some examples to how practices are really working through the new norm. David?
Hey, thanks, Larry. So I'm a big believer that in chaos and tumultuous times there is opportunity. So my name is Dave Boxberger. I work for IT or LightPoint. LightPoint is an IT services company that focuses on healthcare. And in this position, I have the really, really wonderful opportunity to work with about 100 different practices, about 4,500 clinical end users, about 5,000 or 500 docs. And one of the things that I've kind of learned over the past few months, and one of our managers says it really well, is that, you know what, we're not all in the same boat. We're all in the same storm. And some practices are doing fantastically well and thriving, and other practices are struggling. So what I want to do is share with you three things that we've seen our successful practices doing. So there, Mr. Moderator, if you'd move us forward, thank you so much. So the number one thing, and Larry touched on this a bit, is the successful practices developed a vision for the future. And having been in some of these visioning meetings, I can tell you that when the meeting started, there were as many visions for the future as there were participants in the meeting. But by the end, we've usually arrived at one vision for our future. So what did these successful practices do, right? As they visioned, they put the patients first, right? They didn't put the practice first. They didn't put the doctors first. They didn't put revenue first. They put patients first. You know, what do those patients need? What do they need to feel comfortable coming back to the practice? And how can we make them healthier and more successful people? These practices were innovative and they anticipated a lot of different futures. I don't know anyone right now who knows what next month is going to bring, much less 6 months from now. And I don't think as we develop plans, we should be like very rigid in our planning process. I think we need to be really flexible. And to that extent, these practices were very adaptable in the business processes that they looked at putting in place. They got input and buy-in from all the stakeholders. You know, these planning meetings didn't have just doctors and administrators. They had MAs, they had front desk people, they had revenue cycle folks. We need everybody in the practice bought in. They built a plan to realize the vision. I am exceptionally good at building visions. I am not so good at building plans. I know that's my weakness, but we saw our good practices take their vision and condense it down into a plan. They also weren't like overly worried about being right. I think that we're deluding ourselves right now if we can figure out what's going to be happening and plan perfectly. So instead of spending a whole bunch of time navel gazing, right, they came up with their vision, they came up with their plan. They didn't worry about it being perfect and they executed. Next slide, if you would. Thank you so much. The good practices are like doubling down on their business. They're doubling down on their great cultures and their great brand. They're using this as a time to take ground in the market. So what have they done, right? They've like looked internally and said, you know, what makes our practice unique? What's great about us? You know, why do our patients continue to come back to us? They updated their content. You know, Larry touched a little bit about this, right? They're using social media platforms to get their message out in a way that they maybe weren't in the past. We've even seen the EDs here in Portland using social media to let us know that, hey, they've got space in the emergency department. If we need to come in, it's safe and they can accommodate us. These practices are celebrating their culture, right? They're taking great care of their staff. The amount of branded items we've seen a lot of these practices create are pretty significant. We at LightPoint created some branded masks, and a number of our practices immediately said, hey, where did you get those? We want branded masks as well. So we're doing everything we can to like celebrate that culture and that brand. Talked about engaging with patients over social media, video, different ways. Really, these practices have recognized that this is a fantastic time to grow the practice. It might not be a fantastic time to make massive amounts of money, but it's definitely a fantastic time to grow the practice. So, and this is a kind of a more tactical step, and I chose kind of two big picture strategic things and then one kind of in the weeds bit. These practices, by and large, have realized that remote work is here to stay, and they've embraced it. You know, like a lot of you, a couple months ago, we panicked and sent a bunch of people home. We realized that not all of our employees would be thriving at home. Across our practice population, we saw initially about 700 people be sent home to work. We've seen about 300 of these returning to work, but that leaves a pretty sizable chunk of employees who are now working from home. So what are practices doing to kind of take advantage of that? Well, they're setting expectations and they're developing the necessary KPIs to make those employees productive from home. They're realizing that their managers need to understand that managing a remote employee is way different than managing an employee who's sitting at a desk in the office. It is difficult to not micromanage, but it's also difficult, especially with the tools that most practices have right now, to keep a close eye on productivity without micromanaging. So lastly, what these practices are doing is they're figuring out, given their culture, given what they're about as a business, what's the right mix of tools, what's the right mix of oversight they need to one, embrace remote work, get the most out of those employees, and take the most advantage of that situation. So I'm now going to hand it over to Greg, who's going to talk a bit more about remote work and how practices are dealing with this challenge.
Great. Thanks, David, and thanks, Larry. So in my role at SIS Northwest, we're an outsourcing services company for healthcare organizations. I work with a lot of healthcare providers and see where things go well or not. I want to address the challenge of the remote worker and talk to you about practical tips, including things you can do immediately in-house to ensure that the quality of the work is where you want it to be. Personally, I've been working from home for 13 years, and it's worked great for me. I've been watching trends on whether administrative office workers will be going back in the near future. Those analysts closely watching these market trends say that workers generally like working from home. Perhaps your admin staff are back in the office, but what if you don't feel safe or the pandemic intensifies? You may need to not only recognize that some of your operations staff may be working from home going forward, but that actually it's better to embrace it. Working from home can be effective, but I've seen some increased areas of struggles for things like depositing checks, processing payments, patient correspondence, and other documents. So consider this. Set aside the remote worker for a moment. I often tell people that even when people are working from just one office, 100% of accounting offices make mistakes somewhere. I see mistakes at medical offices all the time. Mistakes can be data entered incorrectly, or information that's shared with the wrong person, or misfiled documents. Reducing mistakes and getting the task done accurately the first time drives costs down. Now, with people trying to make their homes work as offices, mistakes could happen even more. Not that you can't trust those employees, it's more about process control. The more repetitive, mundane, and the higher volume of tasks that people are trying to manage, the more mistakes. Mistakes happen when processes aren't in place to prevent them. Again, rework is expensive and can result in lost revenue or upset patients. The amount of time and effort required to find a mistake can easily cost hundreds of dollars for every mistake. Here are some example issues where mistakes happen. I'm not going to read them all, but you get the point. I will highlight the last issue, HIPAA compliance. HIPAA compliance issues can happen when people work from home and are sending PHI through non-secure connections, or simply having confidential patient information in a non-secure home environment. Imagine this scenario. One of your billing staff has a stack of work on the kitchen table, and their son Tommy gets curious and, skimming through these documents, notices that a neighbor has a very personal medical condition and proceeds to spread that information to your neighbors. We've seen much worse things happen over the years. Before I tell you how to avoid these issues, let me give an example of a common daily task that needs to be managed. That's the mailroom. So let's look at your incoming mail. And by the way, this includes email and faxes, not just paper coming in through the post office. For this example, we'll talk about invoices. First, the mail needs to be opened, sorted, prepped, and perhaps scanned if it's in a paper format. Then you're going to review the documents and enter data into your accounting software about the invoice and code costs to appropriate departments. Then mail gets routed, all done manually, usually through emails. Next, someone reviews and approves invoices if necessary. After review, it gets returned to the originator, and then finally, it gets fulfilled and payment submitted. The other issue is that you have to store these documents for legal reasons and be able to find them if needed. So when all this is done manually, you're open to delays, lack of visibility into process and workflow, and mistakes. When you break down the process in this way, it's easier to see all the steps where mistakes can happen. So how do you minimize your mistakes, whether you are a one-office business or have some staff in multiple locations, including some who work from home? Here are some tips you can immediately do in-house to avoid mistakes and reduce costs. You can put better practices in place. Start by separating duties. For example, it's never a good practice to have one person manage both receivables and payables. Not only do you open yourself up for potential embezzlement, but there's no quality control. Which leads to the second point, validation of tasks. It's a best practice to have a second person validate each step. Did the invoice get put into the right account? Are there errors in the account information? Is the payment due date right? Here's an example. When you're reading an email, are you more likely to see a mistake someone else made or one that you made? Train staff to avoid multitasking. Studies show that you lose about 40% of your productivity when you do. We think we can multitask, but our brains are just not set up to do that. We slow down when we start thinking about the next task. Also, take into consideration any HIPAA issues there might be if employees process documents from home. Are they secure? And don't underestimate hidden costs. Did you know that just processing one invoice costs between $4 to $23? Most offices that we see manually processing invoices, posting payments, and other transactions trend towards the high end of processing costs. As an alternative, you can consider outsourcing repetitive tasks or leverage better technology that embeds best practices. Outsourcing can give you more efficiencies, save costs, and improve quality. SIS&W and LightPoint are outsourced services, but of course you have many other options. So let me share some of the technology that can be used to do repetitive tasks faster and more accurately. You could acquire this technology, but a good outsourcing partner has already made these investments and does the work on your behalf. We've come a long way from the old ways of doing things pictured on the left. Leveraging today's technology, a lot of things that used to be done manually can be automated. Here are example technologies now used for repetitive administrative tasks. OCR, or optical character recognition technology, can eliminate approximately 90% of data entry, and then married with double-blind human validation, it results in greater than 99% accuracy of data capture. AI can be used to sort documents based on their characteristics and then direct the OCR engine to capture data from the documents. And automated workflows can ensure that information gets where it needs to go and provide management dashboards to monitor productivity as well as identify stuck processes. Apart from technology options, whether through outsourcing or in-house, or asking for outside advice for changes you can make, I want to leave you with 3 immediate takeaways from this webinar. One of the best tips I can give is to examine and map out your current processes. Ask a lot of why do we do that questions and look for areas where there is duplication of effort and lack of process controls which can lead to mistakes. 2, consider where you might have HIPAA issues in this new environment, including work being done from the home. And the third point is a general tip, a summary from the 3 of us. Be proactive. Restructure for impact, whether it's figuring out how to increase your patient caseload, identifying critical areas for your operations, developing a vision, doubling down and making changes, or embracing and creating the supporting structure needed for the remote worker. Be proactive because we believe it is critical for your practice. With that, we'd like to open up for questions. But before we do, let's give you some quick information on our respective companies. SISNW has 2 offices, one in the Montgomery Park building in Portland and the other one in Seattle. We're experts at creating reliable processes for automating common daily tasks like accounts payable, incoming payments, medical records, patient registration, and much more. Our project management approach to outsourced services offers unmatched quality and accuracy. And we partner with best-in-class partners in technology. We can often save you 50% of your costs for repetitive tasks and help mitigate mistakes. So that's a bit about us. David, tell us about LightPoint.
Hey, thanks, Greg. So like I said earlier, LightPoint's a healthcare IT services company. We have been, next year, I'll be able to say we've been a healthcare IT services company for 20 years. Right now, I have to say 19, which is not that great of a number. You know, I came up with some reasons why I think practices choose us. My hunch is that there's some that I'm missing and that I'm probably wrong about some that are up there. But I think that the reason that practices stay with us and they recommend us to their friends is because we take great care of them, right? We get really invested in the success of our practices and do all we can to make sure that their staff are happy, their patients are happy, and their doctors are happy. So that's a bit about LightPoint. Larry, what can you tell us about your company?
Thank you, David. Thank you, Greg. So why choose CLA? CLA is short for Clifton Larson Allen. We're a professional service company, having more than 6,200 people, 120 locations throughout the U.S. here. And really, our teams are really diversified in their backgrounds, their expertise. And they really do, we all support our clients in the critical support you need. And so we really do know healthcare. We have a lot of diversity in that. And we provide consulting services, advisory services for finance strategy, capital planning, internal audits. So we have a lot of financial CPA for professionals on our staff as well. And we also are absolutely we have independence and the objectivity of our professionals when they really are looking at guiding your vision that we develop with you and the objectiveness of our professionals and getting you to where you want to go, especially in this unique environment. We just have lots of different folks that kind of can come alongside you on a strategic and capital planning in your financial needs as well. So.
All right, thanks, Larry. We ran a little bit over our planned time today. We are going to try to answer any questions if you need to go. We understand. Please watch your email. We're going to be sending out an ebook that summarizes a lot of the things that we talked about. So that should show up in the next day or two. And if you'd like to pass it on to your colleagues, we'd encourage you to do that as well. So thank you for attending. We hope this webinar helped you identify some tips on how to reduce costs, improve services, and be successful. And we'll see if there are any questions.
So this is Liz Garnand. I'm going to suggest, because I don't see that anyone has raised their hand yet, if you have a question, please click on the hand icon and we will identify you. And then Larry, if you can unmute them so that they can ask their question. But just to get things going, I have a question that I think that the audience may be interested in, which is all about capacity and demand. That's pretty critical to a health facility. So I'm wondering if there's an easy way to measure that and how, as a healthcare facility, we can start and do that. Larry?
Yeah, happy to take that one. Historically, let's take the demand part of it. And if you know your your patient volumes and your appointments. And then you also can take a look at a historical visits per day, per week, and the number of your patient hours available. And you know that that's how you're filling those slots, and you can look at any cancellations and no-shows, obviously that excess demand, if you would. What we're finding though is on the not necessarily a lot of changes there. We're finding a lot more changes on the capacity, because capacity is how many patient-facing hours we have as a provider, and how many appointment slots are available, right? And then what's the length of the appointments? What we're finding is a slight decrease in the number of patients that we're able to see per hour on a historical standpoint. So in that, what our capacity is might be slightly lower, but then that's where it comes into play of start measuring that right away, and you're going to get better. But just measure it, because that might be meaning that you need to add hours for evenings or weekends. We're seeing several groups right now doing split shifts, if you would, because people need to be home at times as well. So it's really calculated. There's great information out there on MGMA as well as IHI for demand and capacity, and you can hopefully utilize your management system as well that you have today.
Okay, thank you, Larry. I don't see any hands up right now, so I'm going to suggest another question that I'm imagining could be an important question for the audience. And this one is for you, David. If you could tell me about what are the practices doing to engage with their clients, whether it's using Facebook, websites, an email platform, video, whatever that is, what's working for them right now, and what would you recommend?
Yeah, so thanks, Liz. So I don't want to give away too many great ideas because obviously the practices worked hard to figure these things out. But we definitely see practices using all sorts of social media, from their website to Facebook to Twitter to video engagements to what I'll call almost like a proactive video push to patients to provide content that's meaningful and relevant in today's time, but two, to inform those patients about the status of the practice, when the practice feels that they will be open for business, what that opening for business looks like, and what those patients can expect. I think it's really important to balance this on a per practice basis. Example, right? A PEDS office is probably going to have a much more active social media presence and social media engagement with those parents than say a nephrology practice, and where they may be communicating more via mail and a simple website and maybe just phone calls out to their patients. So I think it's very important that as the practice thinks about communicating to that patient population, that they take a look at that population and choose the method of communication that's right for them, be it social media, phone, video, web, you name it.
Okay, great. I have one last question, and if there aren't any questions, Greg, you can wrap up, but I'm thinking that this may be of interest to the attendees as well. It's around the remote worker and understanding what's going on there. Having employees go in and perhaps grab the mail, take it home, process it, scan it, whatever they're doing. I'm wondering whether there is any kind of, what are the management tools, insight tools that you mentioned? Perhaps it's Greg starting with you, and then David following up with you. Visibility to know what the process looks like or the productivity looks like.
Yeah, thanks, Liz. So to the first part of the question, we've had a number of our customers that have approached us, that maybe we've already been helping out with some of their incoming mail, like their payments or invoices, and they're finding that they're sending some, especially during the worst part of the lockdown, they were sending somebody into the office for no other reason than to pick up mail, and then they'd take it home and try to figure out how to get it to the providers and different department, medical records, billing, AP, et cetera. And it was just creating a huge challenge for them. So there are actually platforms out there. The technology is really amazing that will automatically sort out that mail or a large portion of it. There's still some that may need to be reviewed by humans, but it'll sort it out and it can kick off workflow. So it'll send documents to the billing staff or to AP or to a provider, wherever it needs to go. And then it provides some dashboards for managing that workflow and getting insight into where that mail is. So, if you can imagine everybody working at home and a document comes in and a question comes up about it, how do you know where that's at? So that's kind of the second part of the question is not only utilizing technology to automate some of those manual processes, and for one clinic that we're dealing with right now that actually had some COVID exposure, it's a safety issue too, to keep people from having to go into the office and potentially having a spread or additional exposure. So David, I don't know if you had anything to add to that.
Yeah, sure. Thanks, Greg. So, and I'm sure there's a lot of people who are not going to like this answer, and I don't like it either, but I apologize in advance for it. So one thing that not only LightPoint, but a lot of our practices have done is start to monitor and manage status across multiple platforms. And really what we're trying to determine here, right, is are our remote workers at their desk when we think they should be at the desk? And are they doing what we think they should be doing while they are at said desk? So we, as well as many of our practices, are using our phone systems and then either the EMR or other platforms to manage status from 2 points. This allows us to know, hey, one, is that person like at their desk and available to take a call? And two, are they logged into the system we expect them to be logged into and doing something? Like I said, we and a number of our practices are working on a little more sophisticated KPIs because it's certainly, it was easier for most of our employees and most of our practices employees to get work done in the office. And when they're at home, we're having to come up with maybe some different measurement tools. We have had a few of our practices ask us to put in proximity tools for those employees working at home so that we can more or less guarantee that they are by their computer at home and working when they expect to be there. There are also some tools that are AI-based that are coming on the market that monitor/watch the activity on the computer of the remote user and to make sure that they are doing what we expect them to do. None of our practices have gone so far as to install those tools yet. My counsel to them would be if they have to go that far, they might have the wrong employees at home. But there certainly are a number of kind of both easy and inexpensive to sophisticated and somewhat invasive tools that people can use to make sure that those remote workers are doing what they should be doing.
Great. Well, that's it. I've got our individual contact information up on the screen. If you'd like to follow up with any of us or have some questions, feel free to reach out. And I really want to thank everybody for your time today and for joining us. And again, look for that ebook to show up in your mail soon. Thank you and have a great day.